Let's get in some more voices at this point in time. We've got Ravi Duggal, public health expert, who's joining us on the phone line. Thank you very much for speaking to us. Your perspective here, the issue of vaccine hesitancy, the fact that such a big number of people have not taken their second doses yet.
Yeah, I think if you look at what has happened over the last 2 years, and especially last 1 year when the vaccine was introduced, I think our entire strategy for vaccination has been faulty. I mean, right from the word go. I mean, doing it in batches. Vaccination is something which should be learning from the smallpox experience. It has to be done. If you believe that the vaccine is going to reduce infections and control the epidemic, then it has to be done at one go. You can't, do it slowly and in incremental kind of approach. So I think that is, so people also, they get wary. I mean, over time, they see experiences around them. They see people who are vaccinated, even people with 2 jabs dying, and so on. These are real stories. These are not something fictitious, because your own experience around you guides your decision making. So hesitancy, like there was hesitancy right in the beginning when the new vaccine came, that this is going to be a huge experiment on the general population, because these are vaccines which are not, completely kind of verified. I mean, they've been just given emergency approval for usage. So that is one historical factor, I think, in this whole vaccine approach. Secondly, also overall in our policy, the government policy, there's been a lot of wavering that's happening. I mean, they will come out with messages that Omicron is a mild thing. I think these are messages which create this kind of panic. And I mean, if it is mild, then why do we need to, go for it? And people also, put their masks down. And I've been traveling a little bit, in this just before the third wave, and I see people's behavior also in terms of masking. People don't want to do it, and you go to marketplaces and things like that. So I think I would have expected from scientists at least a much more robust kind of messaging to go out to people, but that has also not really happened, because I think scientists are also finding it difficult to lend out their voice to the people, because the government control over what. And so there has been a lot of wavering there also in terms of information that goes out. And I think there's too much of exposure of information in the public domain. So people really don't know, what to decide on. So therefore hesitancy has crept in. If you keep such large gaps between 2 doses of vaccine, I mean, people may be dying also. I'm not sure. The 60-plus population, those who have got the first jab, they may have died due to some other reason or as a consequence of this. So we really don't know the full story. And, my question is, why so much of information?
Fair enough, Ravi Duggal. Point taken. Yes.
TB, etc., which you don't get information on. Okay?
Yes.
So, yeah, I think this is partially
yes, fair enough. Fair enough, Ravi Duggal. I appreciate you joining us. Yes, absolutely. Thank you so much for joining us with your perspective. Let me also bring in some other voices here. Dr. Rajesh Parikh of Jaslok Hospital is joining us as well. Dr. Parikh, thank you so much for speaking to us. This issue of vaccine hesitancy, the fact that, both in Maharashtra and Tamil Nadu, we have the data here, but this is the case even in other states as well, where a large number of people have missed out on their second dose. They've missed that window. What do you think it is, the main reason is? Because if we were to talk about vaccine hesitancy, they've taken their first dose, but they're not coming out to take the second dose.
Well, I'm not sure what the reasons are, but I think we could hazard a couple of guesses. I would like to believe that the main reason is complacency. People believe the worst is behind them, particularly with the recurrent usage of the words mild variant as far as the Omicron variant is concerned, and people being assured that this too will pass very quickly. It's possible, though, that the second reason is also the amount of false information that is being circulated everywhere. In fact, it's a sobering thought for us to remember that 2 years ago, within a month of the pandemic starting, the WHO had already warned of what it called an infodemic. And at that point, which I think was either February or early March 2020, they said that this infodemic was as dangerous as the pandemic in terms of the health of all of us. And we can clearly see this going around. I mean, the latest, of course, was the very public scandal that occurred with the Australian Open and Novak Djokovic. So there is a mushrooming body of anti-vaxxers. And what I think they fail to understand is that they are harming not only themselves and their immediate families, but they're harming society. I once used the word, bioterrorists for them, because, like terrorists who spray bullets with an AK-47, they are spraying viruses at all of us and endangering everybody around. I think these are the two main reasons, complacency and anti-vaxxer movements.
Fair enough. Dr. Parikh, please stay with us. Let me go back to Ravi Duggal as well. Ravi Duggal, what do you believe then needs to be done in terms of addressing the situation as far as, the people who've missed their window? How can the awareness be created? What should state governments be doing? All right, I think we've lost that line with Ravi Duggal, but we've got Dr. Sanjeev Bagai with us as well. Dr. Bagai, your same question to you. Given the fact that, this is turning out to be quite a serious issue, what needs to be done to address it at this point?
All the states need to be in a little bit more coordination with the center. I think a public awareness message needs to be refashioned and repackaged, so to say. I think statistics speak a lot. I think numbers need to be put out as the recent data, the global data and the Indian data, to show what the risk if you don't get vaccinated for infection, ICU admission, and indeed death as mortality rate. And the effect is startling. It's a 25-fold increase in risk of dying or landing up in the ICU. We need a revised, very, very refashioned public awareness campaign on masking. Not only just masking, but it's the effect of appropriate masking, N95, high specification masking. Put out the numbers and show how beneficial it is to wear a mask, especially in crowded areas and poorly ventilated places. Put out a public message to show what the awareness is for avoiding crowds and highly populated and densely populated places. So I think that is one. And second is, I think we need a more unified approach as far as people who are unvaccinated or partially vaccinated and refusing the second jab to even not allow them in public places, be it restaurants, hotels, airlines, train tickets, and so on. I think we need to put a real focus on this because the time now is short. The window period for us to react is short. Longer we have a large segment of Indian population which is partially vaccinated, then it poses a problem for this virus to mutate again. And that's exactly what we need to avoid.
Yes. Yes, absolutely. And Dr. Parikh, coming back to you, so obviously that is one other issue because there are a lot of people also who say, that I've already received one dose, why should I need to go and take a second dose, possibly not realizing what the implications of that actually are. If you can throw some light on that aspect, what it means when you just take one dose and don't take the second dose.
I do that. I just managed to find some charts which I was using in an update of our coronavirus book, which we wrote 2 years ago. And, they say a picture is worth 1,000 words. If your cameraman can pull back, I'd just like to show you charts which speak for themselves.
Okay.
This on your camera.
Dr. Parikh, I don't think we'll be able to see the charts.
Don't worry. So I'll just summarize them. I'll summarize them.
Yes.
The Municipal Commissioner of Mumbai, Mr. Chahal, released a week ago that 96% of beds requiring oxygen in this current wave are occupied by unvaccinated people. And then I have another chart, and I don't know if this can be seen, but what it essentially says that in the past 11 months in the city of Mumbai, there have been 4,575 COVID-19 deaths. 94% of these deaths are in those who have been unvaccinated. If that doesn't persuade people to get vaccinated, I don't know what will. And of course, your question, I think the data is amply clear from the times of the Delta wave. It was seen that people who have had a single dose are about 39% protected against the virus. People who've had two doses are about 70% protected against the virus. And people who had a booster, the immunity protection goes up to 95%. This, of course, was data from one vaccine. It varies from vaccine to vaccine, but with minor variation, it's more or less the same story. The second dose almost doubles the immunity provided by the first dose, and the booster enhances it too. And it's very, very important to get the second dose. I'd just like to reiterate it. You're doing it not just for yourself, you're doing it for your family, you're doing it for the elders in the family. You may be doing it for the children. You know, in the current wave, pediatric bed occupancy in the United States has gone up by 50%. So you may be doing it for little children, and you certainly are doing it for society and for the country. Please take the second dose if you haven't already.
Right. And Dr. Bagai, sort of just to take that point forward, for those who have missed the window of the second dose, what does that mean now in terms of, you know, factually speaking, technically speaking, do I need to go back and take two more doses, or, you know, even if it's past the window, taking the second dose, what would the implication of that be?
Yeah, that's I mean, that's theoretically a tough one, but I would suggest just get the second dose as quickly as possible on an ASAP basis. And don't worry about if the gap has become slightly more, because the second dose, in a way, is going to enhance your memory recall to start at least initiating the cycle of your memory B cells and memory T cells. So I think I'm still hopeful that one shot is going to give you 93% protection for death. The second shot, is after 2 weeks of the second shot, you're going to get a near 98 to 99% to prevent criticality and death. It's extremely important. I think it's not only your personal choice. Yes, it is your personal choice, then stay at home. But if you are living in a society where other people are intermingling with you, you are responsible to them, and likewise, they are responsible to you. You cannot be living a life in isolation or in silos. So I think you can't build a fortress around yourself and dictate terms to the world. You have to have a particular social norm. There has to be a responsibility. Yes, it's a constitutional right to decide which vaccine you want and whether you want it or not. But this is something which is not a personal infection. This is an infection which is highly transmissible. And if one person gets it, people should understand that in 20 days with Omicron, carrying a R naught exceeding 12, which is more than measles, 1 lakh plus people can get infected. Also keep in mind, almost the only data which has come out of Omicron, which was from 25th November till 30th of December last year, was from Delhi NCR, in which 52% of people are asymptomatic. So you may be carrying the infection and you still won't know. You may not get severe disease, but you can transmit it to a whole others. So please get yourself vaccinated. It's your moral responsibility towards the nation. We have probably another 2 to 4 weeks to really push this drive so that we can suppress this Omicron quickly. We know that the shelf life of this is slightly shorter than Delta, but of course we can't be complacent and can't take it lightly. We have to now focus on the pediatric vaccination, focus on the elderlies and the comorbid conditions and the extremely clinical vulnerable for the third shot. And also keep in mind, soon we should be able to embark on vaccination for the pregnancies. So it's a lot of work still left. I think there is still work within the Indian diaspora for the intranasal vaccine. There is still work going on for the mRNA vaccine, apart from the DNA vaccine in India. And indeed, shortly and hopefully, keeping fingers crossed for what we call as the universal coronavirus vaccine.
Right. Yes, absolutely. Dr. Parikh, this also leads to another point that our reporter was also talking about in Tamil Nadu specifically, where the data has come out of, where booster doses also, don't seem to be picking up. The very, very small percentage of people who've actually come out to take booster doses of the eligible population, just a few percentage of people who've actually come out. So obviously that is also another issue at this point in time.
Absolutely, and unquestionably so. I entirely agree with everything Dr. Bagai said. He brought up several points. I'd just like to reiterate a couple of them. One, it's not just about death. It's also about occupying hospital beds. People are getting permanently disabled as well. It's about oxygenation. It's also about infectivity. How quickly do you spread the virus? He told us that there was an R naught of 12. To just illustrate that, at an R naught of 12, which means 1 becomes 12, becomes 144, and so on, it's less than 20 steps from here to the moon. So that is an enormous number, an R naught of 12. And it is very important for people to get vaccinated. As to the boosters in Tamil Nadu, I think the government must amplify all of its methods to persuade people to take boosters. And something else, we have been a bit behind the curve. In the first 9 months, we were exporting vaccines. We started giving vaccines to our people a bit late after other countries had done so, only when we faced the enormous wrath of the second wave. There has been some hesitation also in terms of allowing boosters to come in, of allowing other vaccines to come in from all around the world. So I think we need to work at all levels. I'm not particularly happy to just be lecturing people saying, go get it done. I think the governments at the state and central level also need to do a lot more to facilitate the availability of boosters. And finally, if people are not availing of these boosters, say in Tamil Nadu, and I believe there are a couple of other states where that's happening too, why not give them to the people who are more than willing to come, but are being told that they're not eligible just because, they're not healthcare workers or they've not crossed 60. So I think the idea should be to administer these vaccines to as many people as quickly as possible, always keeping in mind that it is also a social campaign and not just a medical campaign.
Yes, absolutely, Dr. Parikh. Some very important points that you've raised there. Dr. Bagai, the other part is that we're already seeing a lot of these curbs, so to speak, in terms of restrictions for unvaccinated people, whether it's in terms of ration or entry into public places. And a lot of states have started adopting that aspect. Now, while there is another ethical argument also that comes into place, that how can you, stop essentials from being given to people over vaccines. But do you think then that if this becomes a bigger issue, that would be the only way to go forward?
I'm never in favor, especially in the third year of a pandemic, of any restrictions, lockdown or curfews. It makes no medical sense, especially the weekend curfews, the night curfews. There is no logical sense. There is no scientific basis. And multinational trials have shown that these kind of effects are more detrimental to a person's mental health and economy, and with causing no medical good. What is really important is, like all of us have been saying, is to get the Indian population double vaccinated as a minimum. The special 4 cohort groups as the third vaccine, the pediatric vaccine, the pregnancy vaccines, and of course the huge campaign on masking. But a larger real issue is that if you look at a night curfew or a simple week-down curfew, people who have already suffered for the last 2 years, 3 years, these kind of multiple recurrent jolts will probably never be able to pull them up back on the feet economically. So I think we need to pay a lot of attention on that. Each state needs to involve the local medical associations. This is advice and advocacy which I've been saying for the last 2 years. We must involve the local IMA bodies. We have 14 lakh doctors in India. All of us, this is a very critical point, so I'll just dwell 60 seconds into it. All of us have large clinical bases of practice and a lot of patient following. This vaccine should be readily be made available to all private clinics, all GPs, ensuring that the safety protocols and the temperature control and cold chain is maintained, and the data capture occurs. I think especially the pediatric doctors who are approximately 2.5, 3 lakhs in India, we have been vaccinated over decades. Now, you can't imagine a person going for an influenza or a hepatitis B shot through COVID. I think we need to now remodulate and restructure it so that the data is captured, the precaution is taken, all safety protocols are maintained, but make it as readily available as any other vaccine which is presently being given in India. We need to liberalize it. I think if every doctor who has his own chambers outside the bricks and walls of the government hospitals, even give, let's say, 25 or 50 injections a day, your target will be achieved before probably February.
Yes, absolutely. All right. I'm afraid we're completely out of time. Dr. Bagai and Dr. Parikh, thank you so much for joining us with your perspective on this extremely important issue. But on that note, it's time to slip into a very quick break. We'll be back with more.